This is a way to assess the ribs and whether a rib problem is truly a rib problem or if it's a thoracic spine problem. This works really well for the middle part of the thoracic spine and ribs, but if you're in the upper thoracic spine and like the first through maybe the third or fourth rib, this won't work as well. Same thing if you're like at the ninth rib or lower. So this is really good for like that middle part of the rib cage and the thoracic spine. For my patient's right-hand side, I'm going to be using the ulnar border of my hand on his ribs, and we're really trying to get on the angle of the rib, which will help us latch on. My right hand is going to be crossing over on my patient's left-hand side of his rib cage. That'll help me stabilize. So as I push on the ribs, his whole body isn't rotating. I'm just going to stabilize here, and then I'll apply a force in an anterior, lateral, and slightly inferior direction. I'm just going to be checking joint play of these ribs. And my patient's going to tell me if any of these are symptomatic. Any of these causing pain? This one? Okay. So once you find a problem or a segment that feels like it's not moving well, and if your patient says it's symptomatic, you're just really going to make sure that that is the problematic segment. In order to do so, I'm going to go up one more segment and just check if that one is better or worse than the one that I was just on. So if I'm on this one, is that better or worse than the one before it? Okay, so this one is worse than this one. Okay, so if that one's worse, then I'm going to check the next one higher to see if that one or that one is worse. This one's worse. And as I work my way up a little bit more, that's better. So this one is worse than this one. Okay, so now I'm going to get on this segment that felt like it was worse. Just to confirm, is this one worse or is this one worse? First one. Okay, so that's the one that's most symptomatic. So we're going to find out if this is actually a rib problem, which may be at like the 6th or 7th rib that I'm at right now, or if it's a thoracic spine problem. So as I push on this, the whole thoracic spine is also rotating towards his left side. So if I push on the rib, you can see his whole thoracic spine is rotating towards this side. So what I'm going to do is just unrotate the thoracic spine and see if it gets better or worse. So if I'm pushing on it, is that the symptomatic one? Yeah. Okay. I'm going to hold pressure on that, and then I'll apply pressure on the thoracic spine. Does it get better or worse if I do that? Better. It gets better. And then if I let go, does it get worse again? Yeah. And now it's better again? Yeah. Okay, so that tells me it's a thoracic spine problem, not a rib problem. The reason for that is if I am rotating his thoracic spine, and it's getting worse, and then I unrotate his thoracic spine and it gets better, that tells me it's a thoracic spine problem. I have a couple of different things I can do here. I can mobilize using a mobilization wedge, or I can just use my hands to get that mobilization. I'm going to drag downward on the contralateral side of where I'm standing, and I'll drag upward on the ipsilateral side. Notice how well his skin and fascia drag upwards versus downward doesn't really move very far. So I'm going to drag this downward, starting at about half a segment above where I'm targeting, while on the ipsilateral side, I'm going to start like a segment or two underneath, and I'll drag upward in order to get a good fascial grasp, and I'll get my pisiforms right on the segment that I'm mobilizing. From here, I'm going to shift my body weight right over my hands, as if I were wearing a necktie. The necktie would be coming right over that segment that I'm mobilizing. Then I'll come in and spring at this and come out of it, just to allow my patient to breathe. This is one way to mobilize the thoracic spine. In order to do a manipulation here, I'm going to do that same skin drag, apply that pressure. There's a lot of weight on my patient. I can ask them to breathe in. And then as they breathe out all the way, go ahead. I'm going to start to apply that pressure. I'm not going to let off. I'm going to keep that pressure and just thrust right through. And that might get you a couple of cavitations. I did not get any cavitations right now because I got a few cavitations just a few minutes ago by showing a different mobilization. But when you're doing that manipulation, do not come off your patient. Keep that force on and thrust through it. And this is nice because you can get in and get out. And that way your patient can continue to breathe without them feeling like you're restricting all of their airway. If you guys have any questions on that, let me know. Trying to differentiate between a rib problem or a thoracic spine problem. And in my patient, he had a thoracic spine problem. I'm going to show you the same scenario, but with it being a rib problem. This is all hypothetical. So let's say I'm going down and checking ribs on my patient and seeing what is symptomatic. Let's say he says this is symptomatic. I'm going to go above it one segment and see which one was more symptomatic. And then I'll also go below it. You're trying to find the most symptomatic rib in this scenario. Let's say I find a rib that is most symptomatic, and as I apply pressure and I counter rotate them, so I take them out of rotation, the pressure gets worse or the pain gets worse. That's because I'm now opening up that joint even more, and that's the symptomatic joint at the costotransverse joint. From there, if I apply this pressure and it gets worse if I counter rotate, which case I'm just going to shift my weight over this hand, over this pisiform, as if I were wearing a necktie, it would come right over that rib, and then I can mobilize that rib. You could also manipulate doing the same thing into that rib, and that should help clear out the problem. If it is a rib problem, typically can get a lot better through mobilization and manipulation. Again, that is a way to differentiate between a thoracic spine problem versus a rib problem in patients that have mid-back pain. If you guys have any questions, let me know.